Social marketing is about achieving a sustainable behaviour change. So to do that, you have to engage fully with your stakeholders, but also your target audience and the community. North East Link's Cancer Project is an excellent example of where they've done this. They engaged fully with their community, and then community members became their champions.
The background to the early presentation of Cancer Symptoms project was really the publication of our public health report in 2007, which showed us that some people living in some of our deprived areas were having much worse health outcomes in terms of cancer, and they were living up to 7 years less than other people. The information in our public health report helped us to identify key areas that were suffering more than others with cancer incidence and mortality, which tended to point towards late presentation and people not seeking help early.
I do annual reports every year and I'm monitoring the data and the trend data, and we look at cervical screening particularly. In our area, the trend had been going down year on year with regard to the uptake. And when we looked at the data by age group, it was very evident that women 25 to 29 weren't attending for screening.
We established a steering group quite early on, and we had a number of members of the steering group that were healthcare professionals. We also had some clinical nurse specialists together with health trainers, but importantly we also had members of the community sitting on that steering group, and it was very much an equal power sharing arrangement. The community teams were absolutely fantastic in gaining local insight into the different cancers by going out and surveying their peers in community groups and clubs and pubs, etc. The teams themselves were able to establish actually what people did know about cancer and what their fears and inhibitions were in terms of presenting early.
I've lived within Immingham, which is my local community, for over 40 years. And we decided that we would do the early signs and symptoms around bowel cancer. Primarily it's over 50 as our target audience. The community members have received training from the bowel screening nurse, so that when we went into the community we were able to talk to people with a sound knowledge base. So we go into a variety of different venues within the community. That could be anywhere from a GP surgery doing promotion through to the libraries, resource centres. We've been into schools, the local college, children's centres.
In relation to the cervical screening, I think the information I gave helped to inform them in the educational material and promotional material that they came up with. The materials they come up with are very eye-catching and really seem to have captured the essence of what we're trying to get over.
All of the major supermarkets have been happy to receive the teams, and they'll go and have a stall in there with a table. They have leaflets, but they've also developed a number of quite enticing freebies, which is actually a really good engagement tool.
We're actually giving a free calendar out today, and we're giving leaflets out just to make sure that ladies go for their cervical screening and how important.
It's the fear factor sometimes that people don't attend for screening or don't attend the doctors when they've got early signs and symptoms, and sometimes it's actually the use of the word cancer. And I think the Cancer Collaborative have maybe normalised it, taken the fear out of it a little bit. We measured the awareness across the whole of the 5 PCTs, and North East Lincolnshire were statistically significantly more aware of the early symptoms of cancer than all of the other PCTs in the cancer network, which to us is absolutely fantastic because it means that our social marketing has been very successful.
I think as a healthcare professional, you've always got an idea in your mind of what will be the right way to go. This approach turns everything on its head and says, don't ever assume anything. By all means, have your ideas, but let your community come up with those ideas, and always test them out, because what you had in your mind to start with may not be where you end up.